Lifestyle and pelvic floor dysfunction is the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. One of the things that we focus on when it comes to pelvic floor dysfunction is really exercises, maybe getting some work done internally, but we really pretty much, I shouldn't say totally, but we very much so disregard the impact of the lifestyle on the health of pelvic floor. So for example, living in Southern California, we wear flip-flops quite often. Well, when you wear flip-flops, it really interferes with proper movement, gait, walking ability. That interferes or translates into issues with the psoas, your hip flexors and hip stabilizers in general. If you think of your pelvic floor as a bowl, your legs are connected to this bowl, and therefore how they pull, how they move in that ball and socket joint, which this joint is, impacts the health of the pelvic girdle where the pelvic floor lines on the inside. So if I have something that is attached to this structure and it's not moving properly, that improper movement impacts the integrity of the alignment of that structure, and therefore anything and everything that's attached to that structure is compromised. So like I said, flip-flop interferes with the way you walk. Don't wear it. If you don't have pelvic floor dysfunction, still shouldn't be wearing flip-flops because it sets you up for a failure. If you have it, don't wear it because it's feeding your problem. If you're sitting at your chair, you're crossing your legs, that creates the dysfunction there. If you're sitting with your legs, your feet apart, that creates a dysfunction in the hip joint. If you're sitting with one leg propped against something else than the other leg, that creates an imbalance too. Little things do matter. Your nutrition plays a role, and that's part of your lifestyle. How you eat plays a role. We've done a video on that very subject. We're going to make sure we put it at the end of this video as well. How your posture plays a huge role on the health of your pelvic floor. Your breathing technique is another huge contributor to the health or lack of pelvic floor dysfunction. There are many things that affect it, but specifically when it comes to lifestyle, I wanted to discuss your habits that contribute negatively to your posture. So using your digital devices, not getting up often to move around, perhaps sitting on an exercise ball would be a good thing. I've done a video on that. We're gonna make sure, I've done blogs on that. So explore my blogs on my website to learn more about the things you can do that ergonomically speaking that contribute to it. We're going to put that link to the pelvic floor and ergonomics blog in the description box. Make sure that you check it out, and that should kind of guide you in the right direction. If you have any questions, make sure you use one of the methods of contact in the description box and subscribe to the channel. Until next time, take care.